Today's video, I'm going to show you how to take care of some pain in the butt known as that Piriformis Syndrome. Now, that's usually a blanket term for kind of pain in this area. And if you got trigger points on that piriformis, it's going to cause some hip dysfunction. Now, some of the symptoms you also might be getting is some groin tightness that might be coinciding with the glute pain, but a lot of times this is the symptom. So how do we know what's influencing who? First off, we need to look at how you're moving. So if you're bending forward and touching your toes, are you getting an excessive amount of pulling kind of in that buttocks area, or are you getting a more stretch in the front? If you're getting more stretch in the back with bending forward, most likely we got some hypertonicity, or we've got some overactive, deeper glute muscles that might be an issue. The other thing is we're going to look at single leg balance. Now, somebody who's got a piriformis issue, they are not going to be able to stabilize that hip very well, especially on that balance leg. So they might either compensate by shifting over, or you might see that hip kick out a little bit. Now, if you've got good glutes, you might be able to hide it, but if you go down into a little air lunge, all of a sudden, you'll see that knee collapse and that hip kick out a little bit more. So once you put a little stretch into that gluteal area, all of a sudden, boom, that pelvis kicks out. You know their stability isn't just happening in there. From there, we can go down to the floor, which I will show you the next test to try and see, is it more of a foot-knee issue, or is it a hip and core issue? Okay, so now we want to distinguish whether this is a foot and, foot, ankle, knee stability problem, or if it's more of a hip core. So I'm going to do the right side. We're going to suspect that we have a left glute issue on the right. So you're going to go into a half kneel, okay? See if the client, or if you can go into a straight vertical position here and just pick up that front leg. You should be able to relatively easily do this, but you're looking at that hip position. If somebody doesn't have a good hip stabilization program going on, they're immediately going to pull into those hip flexors. So if we go to the left one and we compare right to left, you're going to pick that up and you're going to ask yourself or ask your client, does one side feel different? They might say, oh, you know what, this is harder. Or you might see them kind of dip into that hip flexor. So that's an indication that the hip complex isn't stabilizing like it's supposed to. What we can do next is we can see straight leg raise. Compare one side versus the other. If I lift this left one, do I feel more tension in the back, or is it more pinch in the front? If it is a piriformis issue, you might be getting extra wiring up of those hamstrings. So all of a sudden, the left leg feels heavier than the right. Okay, a Faber's test might also show that as well, because TFL might also be kind of wiring or compensating with it. So we've got a few things to check, but you're going to go back and recheck the main thing that was a little bit off. So might be single leg balance, might be that half kneeling balance, might be a hip mobility, straight leg raise, or Faber's test. But go back and check those things after we do the intervention. Okay, we've determined that the left hip is the dysfunctional hip where most of our tightness is coming from. We poked around on the groin muscle. Doesn't seem to be much in there, but there is tightness. But especially sitting on the floor or sitting on the foam roll, you can really feel some speed bumps kind of bumping around in there and some trigger points. So we're going to do pinning and moving. Now, when we foam roll, anytime we do manual therapy, we're changing the input to the brain around that muscle. Either we're increasing proprioception, decreasing the tone. Regardless, we're just changing the overall input signaling to the brain, which then gives us an opportunity to change the output. So, not typical foam rolling. We're actually going to do some what we call pin and move. So you're going to locate where that nice little rope is there, and you'll find it, and you're going to sit on it, okay? If this is too much pressure, you can do this on the floor, okay? So spread that out. Using a nice soft ball can do it. Lacrosse ball, I don't recommend. It's too direct, and you could actually irritate the sciatic nerve. So you're going to take your hand, you're going to place it on the front of your knee here. I am actively pushing my knee towards my hand, and I'm adding resistance with the hand. What this is doing is it's activating all the groin muscles, so the inside thigh muscles here, which oppose all the glute muscles. So we're using reciprocal inhibition by activating these muscles on the inside. It's actually turning off the muscles from the outside. So we're going to get a double effect. We're not just getting the pressure from the foam roller to relax the muscle, but we're also using neurological tricks to try and inhibit and downregulate it as well. So I find 3 to 5 good contractions and then push that hip out a little bit more to get a little bit more range. Okay, that's usually all it needs. You might need to go rolling around, find another spot. You can do the same thing on that there. You can even go to the outer hip, maybe go after those adductors a bit. Sorry, the abductors, the glutes. So that's where we might need to roll a little bit forward, okay? Roll a little bit back. And same idea, I'm crossing the legs. I'm activating the groin muscles, the adductors, to inhibit the abductors. So you're gonna pin it and you're gonna move in the opposite direction. I'm gonna create some extension. I'm gonna bend the knee because the IT band does attach to the glutes and the lateral hip. So I can kind of pin and strip that out a little bit. I got a little spot there. Okay, but the idea is we are using our own muscle activation, plus we're strengthening. So we're lengthening and strengthening at the same time, okay? It's gonna be much more effective than just kind of rolling around, because that could actually activate muscles. So we're doing this a little bit more intentionally to defacilitate those overactive muscles. So now we've created some space. We've created some new input. Now we need to integrate movement. So this is where we have a window of opportunity to teach the body to move in a different way. So what we can do here is we've got a couple options. We can reach, rotate. I love this stretch. So shin box, reach, and just do some movement here. So I'm opening up and I'm stretching this lateral arm line here all the way into the hip. I can press my left knee into the floor. Again, we're playing with that reciprocal inhibition. I can drive my leg backwards a little bit more to open this up, but we're gonna do 5 breaths on this side. Okay? And then we can come into an active shin box where we can reach and lean towards the right hip, rotate opposite. Okay, and then we're gonna go back to the left one, so the active one that we just worked on. So get that shin nice and squared up. Get this leg back. I'm gonna rotate. So I'm getting some eccentric lengthening in that left glute at this time, but then I can push out, so I'm getting some length and strength. Come on down, inhale up, I can rotate away. Inhale, exhale down. Okay, so that's a nice lengthening and strengthening there. From there, we can get our legs up, about shoulder width apart. We're gonna turn the feet in. We're gonna go arms out to the side, and we're gonna rotate towards the foot. And I'm taking deep breaths here, and exhaling. Inhale, exhale. And I'm not just reaching here, I'm really reaching back for this wall here. And I'm keeping those toes turned in so I can get a nice stretch on that outer line here. So I'll turn this way so you can see. We're gonna do the right side, open, rotate, and reach. Deep breath. With each exhale, see if you can go a little bit further. Exhale. Good, okay? So we're trying to improve rotation, not just in the hips, but the thorax, because you got these fascial lines that cross the shoulders, they cross the thorax, across the hips, and they work their ways down. So that could be a contributing factor why some tightness might be there. Cool. Lastly, so we're gonna lock in with some strength. So we change the input with our foam roller or lacrosse ball, manual therapy. We integrate new movement with breathing. So we're actively moving and lengthening and strengthening, and then we're gonna lock in with some strength. So a nice one to do is you can prop up into a side plank. Make sure you can feel the obliques, the back glutes and the lats. Clam that, okay? Keep those glutes locked on, and then you're just gonna do a reach. Now I'm not dropping into my hip here, okay? I don't wanna facilitate hip flexors. I wanna keep those back glutes on, and I'm just reaching and rotating. Inhale, exhale. Inhale, exhale. Good. Okay. 5 reps each side is a good set to do. Let's go back up into standing and we'll lock that in with a functional pattern.